This is looking at esketamine. A 48-year-old woman in treatment for depression with venlafaxine XR225 a day transfers care to your clinic after the retirement of her previous psychiatrist. She states that she is stable on her current medication, but is still only about 60-70% out of her depression. She has recurrent major depressive disorder and has been treated with several antidepressants, and none have been more effective than her current venlafaxine. She states she's recently learned about esketamine treatment and asks if she is a good candidate for it. Which features of this patient's depression, if confirmed, would make her a good candidate for esketamine treatment? Early onset depression, MDD with suicidal ideation or behavior, MDD with recurrent episodes, MDD with melancholic features, or treatment-resistant depression. Which of the following is esketamine's most likely mechanism of action? A serotonin 2A receptor inverse agonist, a GABA-A receptor positive modulator, a monoamine oxidase inhibitor, an N-methyl D-aspartate receptor antagonist, or NMDA receptor antagonist, or a serotonin and norepinephrine reuptake inhibitor. Given the unique action of esketamine, which of the following are the most appropriate precautions to take when initiating esketamine therapy? Assess for a history of intracerebral hemorrhage or aneurysmal vascular disease before initiation. Monitor the patient for decreased blood pressure during the post-administration period. Administer esketamine daily for the first month to establish efficacy. Conduct weekly liver function tests to monitor for hepatotoxicity, and or monitor the patient for depersonalization, derealization during the post-administration period. Esketamine is an adjunctive treatment for use with an oral antidepressant. Which of the following medications are likely to lead to increased esketamine levels? Choose 3: bupropion, escitalopram, fluoxetine, mirtazapine, and paroxetine. What do you make of this? So, which of the following medications are likely to lead to increased esketamine levels? So this has to do with drug-drug interactions and increased levels, so maybe something that affects absorption, or metabolism, kind of inhibits metabolism, or maybe interferes with excretion, right? So, you kind of, again, sometimes, and the test is long, you can get tired. Sometimes you just have to I gotta just gather my thoughts. I have to kind of almost direct myself in the right direction and kind of home in on the question. Because after a while, and I guarantee you, you're going to hit times, early, late, middle, where you're like reading words and they're just not sinking in. You got to take a breath, focus yourself, and just read again. It's okay. You're going to have enough time because you're going to spend your time in a productive way. You're not going to be sitting there frozen in indecision. So which are the features that make this patient's depression a good candidate for esketamine? Well, it has 2 FDA indications, so that makes it clear for us. It's MDD with suicidal ideation and behavior, and the other one is for treatment-resistant depression. It's an N-methyl D-aspartate receptor antagonist, glutamatergic. And then, what do I really need to take precautions at? And especially the first one is super important. Assess for a history of intracerebral hemorrhage or aneurysmal vascular disease before initiation. And then also, as we went over, the associative symptoms of derealization, depersonalization are super common, can occur in a majority of patients. And it may not be a big deal, but it could be very frightening to people. People can get quite agitated, upset, afraid, calling out, especially someone who's never experienced something like that. And it's not so much, the problem is not so much decreased blood pressure, but increased blood pressure. So you do have to monitor for that, actually. Now, esketamine is metabolized by CYP2D6, and the three strong 2D6 inhibitors are 2 SSRIs, fluoxetine and paroxetine, but also bupropion.